So lip enhancement is a very common request from our patients. By lip enhancement, patients can be looking for different things. Often they're looking for an increase in the volume of their lips, but just as frequently, they're also trying to address issues of shape of their lips, the symmetry of the two sides of the lip or of the upper lip relative to the lower lip. Sometimes the amount of incisal show that they have when they smile. So lip enhancement can actually address quite a lot of different subtleties of lip shape, volume, contour, and symmetry. When you get it right, beautiful lips can really highlight a smile and light up the face. With many of these procedures, there are different ways to go about it. You can augment the volume of the lip and change the shape with fillers, like hyaluronic acid fillers, and that gives us a lot of control over shaping the lip. Those fillers are not permanent, and so patients will, if they like it, will often have to come back every 6 months or 12 months to have them filled again or have different parts of them filled as need be. We can take the patient's own fat and use that to shape the lips and augment the volume of the lips as well. And there are also implants that we can place in the upper and lower lip. Soft silicone implants that move with the lips as they move naturally, that are placed deep below the muscle in the lip so that they're hidden, but serve as a kind of platform to push the soft tissues of the lips up and out and add to the volume. And sometimes we'll do both. We'll place an implant to add a baseline volume to the lips, and then over that we will add a hyaluronic acid filler or fat to give us more power and control in shaping the contour of the lips or the volume. We look at the symmetry of the upper lip and the lower lip in terms of volume. Ordinarily, the lower lip is a little bit fuller than the upper lip, but there's room to play with that. But you have to know those proportions and what's natural if you're going to modify things and play with things a little bit. Lastly, we'll typically have patients bring in pictures as well to give us a better idea of what they're trying to achieve. But it's all part of that initial conversation, which is really we view as an integral part of the surgery itself. So the recovery from lip augmentation really depends on what we're doing. If you're shaping the lips, enhancing the lips with filler, you'll be a little bit swollen for a day or two, but really you can go back to your regular activities very quickly, virtually all of your normal activities. If we're using fat to augment the lips, usually the amount of fat that we need to harvest for a lip augmentation surgery is also relatively small. So even though there are two operative sites with fat transfer, the site of the fat harvest and then the lips, the recovery from that surgery as well is usually very fast. When we place a set of implants in the upper and lower lip, the incisions for that are very small. They're just in the corners of the mouth on either side. We usually use absorbable sutures that just disappear on their own. And there too, the recovery from that procedure is very fast, and patients can usually return to their regular activities very quickly.